Today, 1 billion people are suffering from a mental health condition or substance use disorder globally. That is around 15% of the world population. It is therefore inevitable that most people will be impacted by psychiatric disorders at some point in their life, either because they are diagnosed themselves or because family members, friends, neighbors, or colleagues are. But how do we know when people need treatment? Or how do we diagnose confidently? The truth is that approximately 50% of all mental health patients will be misdiagnosed initially and therefore receive insufficient or harmful treatment. In bipolar disorder, devastating 70% of patients are misdiagnosed, with an average of 13 years passing before proper corrections are made. It is simply not good enough. But why are we failing so badly in diagnosing mental health disorders? Well, statistically, only 1% of healthcare budgets are allocated to mental health conditions. And globally, we only have one psychiatrist for every 100,000 people. So that is part of the answer. But it is also about diagnostic tools, and it is about the minimal experience in psychiatry that most general practitioners have. They simply fail to succeed because they have limited knowledge, limited time, and limited access to resources. So what can we do to alleviate this unsustainable situation? We can start by filling the knowledge gap, by minimizing time constraints, and by eliminating access to resources. We can provide doctors and healthcare professionals with a sophisticated software tool based on artificial intelligence that can help them be confident in making proper decisions in the future. So that is exactly what we have done. We have developed the smartest virtual psychiatrist the world has ever seen. We call it Dr. Dia. With Dr. Dia, all that healthcare professionals have to do is enter the patient data in the system or speak the data to the virtual doctor. And after completion, Dr. Dia will give them the most likely diagnosis and suggestions for proper treatment in return. Dr. Dia can furthermore be combined with our other virtual doctors, Dr. Ko and Dr. Thera, whom can analyze the data and facilitate treatment with cognitive interventions and psychological therapy as well. We call it sustainable interventions. Doctors call it smart assistance, and patients call it life support. For more information about Dr. Dia, Dr. Ko, or Dr. Thera, please reach out. Your choice, your patients. Virtual doctors, disrupting the way of doing psychiatry.